Our doctor is on call, and today we're happy to welcome Dr. Ronald Brown from the Hillcrest Advanced Wound Center to the show. This is actually the last day of Wound Care Awareness Month, but of course, this is an important topic for the whole year. Thanks for joining us.
Thank you for having me today.
Well, first of all, what kind of wounds are you treating on a daily basis? You know, some people may not know about these specialty centers that are out there.
There's many in the city and across the state. We're not for acute wounds. You need to continue to go to your primary, to emergency rooms or urgent care centers for an acute wound. Once there's complications or the wounds don't seem to be progressing, that's where we come into the picture. Surgical wounds that fail, we call it dehisce when the surgical wound opens up, and they refer to us for further care. So we play a big role in healthcare in this area because surgeons have better things to do than take care of the wounds. That way they can proceed with their surgeries and we can help them manage those patients. But diabetic ulcers, venous leg ulcers, these are chronic problems that I'm not sure how these patients actually were managed prior to wound centers. So we're all busy, they're all across the state, and but we're not for acute wounds. We're for wounds that are failing treatments and chronic wounds and things that just don't respond.
Now, what elevates an injury from something maybe you can treat at home to maybe needing the ER or urgent care?
Well, typically wounds progress and heal at a normal rate. We expect 50% closure in about 4 weeks typically, but there's just a lot of misconceptions about how to care for a wound, whether it needs to be open to air. Wounds always need to be covered and kept slightly moist. We're trying to grow tissue and skin, and we need the right environment to do that. So we've got to start with a clean wound and free from infection, and then we keep that environment right for healing, not too moist, but covered and moist, and the wounds respond. The body does the healing for us, so we just have to make sure that everything is right for that. There are some special treatments and things that we do at the wound center that aren't available, such as casting and compression wraps and things like that are needed to get some of these wounds to heal. So
kind of going off that, you know, chronic wounds from things like diabetes, you know, how are those treated?
Well, one of the biggest problems with diabetic type wounds are on the foot, and mainly it's pressure and offloading, and that same thing applies to pressure ulcers for paraplegics and patients that have no sensation. It's offloading the pressure. So one thing we do in the centers is we cast. We put patients in cast to keep pressure off the bottom of the foot so the wounds can actually heal and progress well. So sometimes they just don't respond unless we can offload those pressures. Same thing with paraplegics and pressure wounds and things like that. We've got to deal with the pressure. So we can't solve that problem, we can't get the wounds healed. But just managing these wounds, keeping them out of the hospitals, keeping them out of the urgent care centers, and trying to monitor for signs of infections, we can help these patients heal at a much faster rate.